Have you ever felt something wasn't quite right after a long night, even though you couldn't explain why? Maybe you woke up tired, foggy, or strangely unsettled, and you told yourself it was nothing. A patient of mine once shared a moment like that. She thought her restless nights were just part of getting older until one morning she couldn't hold her coffee cup without her hand trembling. I want you to imagine this with me. Picture your body trying to whisper a message while you sleep, a message so subtle that most people overlook it until the whisper becomes a shout. For many older adults, poor sleep feels like an unavoidable part of aging, something you simply get used to. But the truth is far more serious. Sleep isn't just a break from the day. It's a powerful neurological reset that stabilizes blood pressure, repairs blood vessels, reduces inflammation, and keeps the brain functioning at its best. When that reset is interrupted night after night, the body sends signals long before a major stroke ever occurs. Most seniors ignore these early warnings because they seem mild or inconsistent. A little snoring, a sudden awakening, a moment of confusion in the morning. They don't feel dangerous, but science tells us they are. Recent medical studies in the United States show that sleep problems, especially breathing pauses, irregular sleep cycles, nighttime gasping, or waking up disoriented, can predict stroke risk months or even years in advance. After decades of caring for older adults, I've seen far too many patients overlook these subtle signs until a silent stroke changed their life. And yet, there is hope. Knowledge gives you control. Understanding what your sleep is telling you can protect your brain and your independence. In this video, you and I will explore how sleep problems affect circulation and brain health. We'll uncover the hidden triggers that often go unnoticed and talk about the small, daily habits that strengthen your body's defenses. My goal is not to scare you, but to empower you with information that can prevent disability and help you live with confidence. Stay with me, and if you find these insights valuable, remember to subscribe so you never miss another essential conversation on Senior Health Daily. The science, how sleep problems reveal stroke risk. When we talk about stroke risk, most people immediately think about daytime behaviors. What they eat, how much they move, whether they take their medications. What many seniors never realize is that some of the most powerful influences on the brain and blood vessels happen quietly, behind the scenes, during sleep. Sleep is not simply a pause in your day. It is a deeply active biological process, a time when your heart, blood vessels, and brain go through essential maintenance work that keeps you safe. When that maintenance is interrupted, the consequences can ripple through your entire body. I often explain it like this. Imagine your brain as a busy city. During the day, traffic is constant. Information moves in and out. Your emotions, memories, and decisions are like cars on a crowded highway. But at night, the city depends on a cleanup crew. They sweep away toxins, repair structural wear and tear, and prepare everything for the next day. If that crew is interrupted, the city wakes up cluttered, stressed, and unstable. The same happens inside your brain. Deep sleep is when toxins are cleared and inflammation is reduced. If your sleep is fragmented or shallow, this repair work doesn't happen as it should. Over time, inflammation builds up, vessel walls become more fragile, and stroke risk rises. Poor sleep also disrupts blood pressure in ways that surprise many people. Normally, blood pressure drops at night, giving your heart and vessels a much-needed break. But if you're waking up repeatedly, gasping for air, or tossing and turning for hours, your blood pressure may stay elevated when it's supposed to fall. This nighttime hypertension is a major predictor of stroke, especially in adults over 60. I've seen patients who maintain decent daytime blood pressure, yet experience dangerous spikes at night without even realizing it. Oxygen supply is another piece of the puzzle. When breathing becomes irregular during sleep, even for a few seconds at a time, the brain receives less oxygen. These dips force blood vessels to constrict and the heart to work harder. With repeated episodes, the vessels become irritated and prone to damage. Small clots can form more easily, and over months or years, this creates the perfect environment for a silent stroke. Most people have no idea this is happening while they sleep. Cortisol, the body's stress hormone, also plays a role. When sleep cycles become irregular, cortisol levels rise. High cortisol thickens the blood and makes clot formation more likely. Think of it as your body entering a mild state of alarm, night after night. You may wake up feeling tired, irritable, or foggy, but beneath that discomfort is a deeper physiological imbalance that needs attention. I want you to remember this. Sleep problems are not just inconveniences. They are signals from your nervous system and cardiovascular system that something is off. The body is remarkably intelligent. It gives us warnings long before a crisis happens. Understanding these signals is how we stay ahead of stroke risk, rather than reacting after damage has occurred. In the next part, we'll look closely at specific sleep problems and explore why they serve as hidden stroke triggers that so many seniors overlook. Sleep problems that serve as hidden stroke triggers. As we move deeper into this conversation, I want you to think of sleep as a window into your brain's hidden struggles. Most people assume that if something serious were happening, it would hurt or feel dramatic or stop them in their tracks. But stroke risks rarely announce themselves loudly. They whisper through subtle nighttime patterns so easy to dismiss that millions of older adults ignore them for years. Today, I want to bring those whispers into the light. Let's begin with the biggest and most overlooked one, sleep apnea. I've lost count of how many patients shrugged and told me, "I've always snored," as if snoring were nothing more than an annoying habit. But sleep apnea is not just snoring. It is the repeated stopping of breathing during sleep. Each pause deprives the brain of oxygen, forcing blood vessels to tighten and the heart to pump harder. Over time, these oxygen drops damage the lining of blood vessels and make clots more likely. If you wake up gasping for air, experience dry mouth, or suffer from morning headaches, these are not harmless quirks. They are red flags. And because the episodes happen during sleep, many seniors don't realize how often their breathing stalls. Another silent trigger is insomnia and fragmented sleep. Many older adults tell me they fall asleep easily, but wake up again and again through the night. They chalk it up to aging or stress. But every nighttime awakening raises blood pressure for a moment, interrupting the body's natural rhythm of repair. Deep sleep is when arteries become more flexible and the brain clears inflammation. Without it, the vessels become stiff and more susceptible to damage. Studies show a strong connection between chronic insomnia and hardened arteries in adults over 60. I've seen this pattern repeatedly in my practice. A patient struggles with years of poor sleep, and then one day, a mild stroke appears to come out of nowhere. Other triggers are even more deceptive, like frequent nighttime urination or nocturia. Many seniors assume this is just a bladder issue, but often it's a sign that the heart is struggling to manage fluid shifts during the night. Each trip to the bathroom pulls the body out of deep sleep, destabilizing nighttime blood pressure. When this happens night after night, the risk of vascular strain increases significantly. Then there are conditions like restless legs or nighttime tremors, which may seem unrelated to stroke risk at first glance. These movements reflect a dysregulated nervous system. When the nerves are firing unpredictably, it creates stress signals throughout the body that elevate vascular tension. Some of my patients dismissed their restless legs for years without realizing how heavily their sleep quality was being disrupted. One of the most concerning signs is waking up suddenly with confusion. Seniors often blame it on dreaming or being overtired, but sudden disorientation can signal a mini stroke that occurred overnight. These events may resolve within minutes, so they are easy to overlook. Yet each mini stroke leaves behind tiny areas of damage that accumulate over time. If you wake up feeling temporarily lost, unable to remember where you are, or confused about the time of day, please don't ignore it. Another overlooked trigger is excessive daytime sleepiness. When the brain fails to enter restorative sleep phases at night, you may feel tired no matter how long you were in bed. This is strongly associated with silent strokes. These small strokes don't cause immediate disability, but they erode cognitive function and speech over months or years. Finally, Waking up with numbness or weakness is a red flag symptom that something significant happened during sleep. These sensations might fade quickly, but they are the body's way of saying there may have been a nighttime mini-stroke. The most heartbreaking part is that many seniors normalize these patterns. They say things like, "I'm getting older," or, "I guess this is just how sleep works now." But age should never mean accepting symptoms that signal danger. If we learn to read these nighttime messages, we can take action before the brain suffers irreversible harm. In the next part, we'll explore the triggers that seniors commonly ignore and why those seemingly harmless behaviors can quietly increase stroke risk over time. Stroke triggers seniors commonly ignore. As we move forward, I want to shine a light on something that often surprises my patients. Many of the most dangerous stroke triggers are not dramatic events or clear medical emergencies. They're small, familiar habits and reactions that become so routine people stop noticing them altogether. These patterns are easy to overlook because they don't feel threatening in the moment. They feel normal, even harmless. But over time, they quietly shape the health of your brain and blood vessels. Let's start with one of the most common things I hear from older adults: ignoring loud snoring or obvious pauses in breathing. Snoring is so common that many families treat it as background noise. A spouse might nudge the other to roll over, or someone might joke about how loud they are at night. But when snoring is paired with choking, gasping, or breathless pauses, it's rarely a laughing matter. These episodes place enormous stress on the cardiovascular system. The brain fights for oxygen, the heart spikes in effort, and the body experiences repeated micro-injuries to the vessel walls. Many seniors tell themselves they've snored their whole life. They assume it's nothing new, but the truth is that aging blood vessels can no longer tolerate that nightly strain. Another behavior people dismiss is treating morning dizziness as low blood sugar or simply getting up too fast. Morning dizziness can be a sign that the brain didn't receive adequate oxygen during the night. When oxygen levels dip repeatedly, even for a few seconds at a time, the brain wakes up disoriented. Seniors often brush this off because the dizziness fades quickly. But that momentary imbalance may reflect deeper vascular stress. I've had patients who experienced morning dizziness for years before a scan finally revealed they had already suffered several silent strokes. Memory lapses are another trigger people normalize far too easily. Forgetting a name, misplacing keys, or losing track of a conversation can seem like ordinary aging, but sometimes these small slips are early signs that the brain's nighttime recovery process isn't working properly. When sleep is disrupted, the brain cleanup crew that removes toxins and resets neurological pathways can't do its job. Over time, this creates tiny areas of weakness that affect memory and executive function. Many seniors never consider that poor sleep might be the root cause of their forgetfulness. I often see seniors take sleep medications without guidance, believing that anything over the counter must be harmless. But some sleep aids affect breathing depth or alter the sleep cycle in ways that increase stroke risk. Others mask real underlying issues, like sleep apnea. Medication is not always the enemy, but unsupervised or prolonged use can create complications. One of the hardest conversations I've had with patients is helping them understand that the pills they relied on for years weren't solving their sleep problems, only hiding them. Then there's the issue of too little sleep or even oversleeping. Both extremes can increase stroke risk. Short sleep doesn't give the body enough time to restore the vascular system. Too much sleep may indicate an underlying neurological issue or chronic fatigue caused by poor nighttime oxygenation. Seniors often think sleeping more is a sign of healthy rest, but in some cases, it's a sign the brain is struggling. When I talk to older adults about these triggers, the most common reaction I hear is this: "I thought it was normal, and I understand why." Aging changes the body in subtle ways, and it's easy to assume every new symptom is simply part of getting older. But growing older should not mean ignoring potential danger signals. Your body is always communicating with you. The question is whether those messages are being heard. In the next part, I will share real stories from patients whose lives changed because of these hidden triggers and others whose health dramatically improved once they finally addressed their sleep problems. These stories may help you see your own symptoms in a new, more hopeful light. Real-life examples. I want to share a few stories with you, stories that have stayed with me for years, because they remind me how easily the body tries to warn us long before a stroke ever happens. Every time I think about these patients, I'm reminded why conversations like this matter so deeply. One of my patients, a retired teacher named Helen, came to see me after her daughter noticed she was falling asleep throughout the day. Helen insisted she was fine. She believed it was simply part of being 72, especially since she had always been a light sleeper. But whenever I asked about her nights, she would tell me, "I sleep long, just not well." That sentence alone revealed more than she realized. Long sleep without feeling refreshed is one of the clearest indicators that the brain is not entering restorative stages. I encouraged her to do a sleep study, but she hesitated for months. Finally, after waking up one morning feeling confused about the date, she agreed. The results showed moderate sleep apnea. For years, her brain had been receiving uneven oxygen. She had already experienced 2 small silent strokes without knowing it. They hadn't caused obvious paralysis or speech issues, but they had left small marks on her memory and processing speed. When we started treatment and adjusted her sleep routines, her daytime energy improved dramatically, and follow-up scans showed her risk markers decreasing. Helen once told me, "I wish I knew sooner that my sleep was talking to me." Then there was William, a former engineer who prided himself on being sharp and independent. He brushed off loud snoring, brushed off nighttime gasps, brushed off the way he would wake up in the morning with pounding headaches. He told me, "My father snored, I snore, it runs in the family." But snoring doesn't run in families the way eye color or height does. Snoring often runs with unrecognized sleep apnea, which can be inherited. One morning, William's wife noticed he was struggling to button his shirt and his speech sounded slightly thick. By the time he came to the clinic, the symptoms had improved and he insisted he was fine. But a scan revealed that he had suffered a mild stroke. His nighttime breathing had been interrupted hundreds of times a week, each event stressing his blood vessels until they could no longer withstand the strain. After treatment and lifestyle changes, he regained much of his function, but even he admitted later that he wished he had taken those nighttime symptoms more seriously. Another patient, Maria, experienced frequent nighttime urination for years. She believed it was due to age or drinking too much water in the evening, but when I asked her about her sleep, she admitted she never reached deep rest. She told me she often woke up with her heart racing. What she thought was a bladder problem was actually her heart struggling to handle fluid pressure overnight. Within a year, she experienced a minor stroke that left her with temporary weakness in her left arm. The signs were there long before, buried in her nighttime patterns, but she didn't know what they meant. I also remember Thomas, an older gentleman who experienced restless legs so frequently he would lie awake for hours. He thought it was arthritis or nerves. He had no idea that the constant movement was preventing his body from entering the deep sleep stages needed for brain repair. He often felt foggy and forgetful during the day, chalking it up to old age. After treatment, his clarity improved dramatically. He once told me that he didn't realize how much his sleep was affecting the way he thought, remembered, and reacted throughout the day. These stories share a common thread. Each person experienced symptoms that seemed ordinary. Each dismissed the signals because they didn't seem serious. But every one of those symptoms was a quiet message from the body saying, "I'm struggling." Not all strokes can be prevented, but so many can be delayed or softened when we learn to recognize these early signs. The human body rarely breaks suddenly. It usually bends quietly over time, asking for help long before it reaches a breaking point. In the next part, I will guide you through practical steps you can take to protect your brain and improve your sleep. These are simple, everyday adjustments that can make a profound difference for your long-term health. Action steps seniors can use daily. Now that you understand how sleep problems can quietly shape your stroke risk, I want to shift from awareness to empowerment. Knowledge is powerful, But action is what protects you. I've seen countless seniors transform their sleep and reduce their risk through small, steady habits. You don't need dramatic changes or complicated routines. What you need is consistency, attention to your body, and a willingness to adjust daily patterns with compassion for yourself. Let's begin with something simple and deeply effective: sleep positioning. Many people don't realize how much posture affects breathing at night. Sleeping on your back can cause the tongue and soft tissues to fall backward, narrowing the airway. For adults who snore or experience sleep apnea symptoms, this can worsen oxygen drops. A slight adjustment, like sleeping on your side with a supportive pillow, can help keep your airway open. I often recommend that seniors elevate their heads slightly using a wedge pillow or an adjustable bed. This small angle can reduce nighttime congestion and make breathing more stable. Nutrition also plays a bigger role than most people expect. Certain minerals support deep relaxation and healthy nerve function. Magnesium, for instance, can help the body ease into deeper sleep cycles. Leafy greens, nuts, seeds, and whole grains are simple ways to increase magnesium naturally. Some seniors benefit from a low-dose supplement, but it's important to check with a healthcare provider first. Avoiding heavy meals, caffeine, and sugar late in the evening also helps stabilize nighttime blood pressure and reduces nighttime awakenings. Gentle pre-sleep routines can calm the nervous system. I often teach patients a simple breathing technique to use before bed. Inhale slowly through the nose for 4 seconds, hold the breath for 2 seconds, and exhale through the mouth for 6 seconds. This helps lower cortisol, the stress hormone linked to poor sleep, and increase stroke risk. Doing this for 5 minutes can soften tension throughout the body and prepare the mind for rest. Another key step is tracking nighttime symptoms. You don't need complicated devices. A simple notebook works beautifully. Each morning, jot down how many times you woke up, whether you gasped for air, if you felt confused, dizzy, or experienced morning headaches. Patterns often reveal themselves within 1 to 2 weeks. Many patients have told me that keeping track helped them realize their symptoms were far more frequent than they believed. Awareness is always the first step toward meaningful change. Knowing when to see a doctor is also crucial. If you suspect sleep apnea, experience sudden nighttime confusion, wake up gasping, or notice numbness or weakness in the morning, don't wait. These symptoms deserve evaluation. A sleep study may sound intimidating, but it is one of the most valuable tools we have for understanding what happens to your brain and body at night. Modern sleep studies can often be done at home, in your own bed, with simple monitors. Lifestyle adjustments matter too, especially in the evening. Creating a calm environment can help your body wind down naturally. Dimming lights, turning off screens at least an hour before bed, or listening to soft music can signal your body that it's time to rest. Hydration timing is important. Drinking too much late in the evening increases nighttime urination, which fragments sleep. Try to drink consistently throughout the day and taper off after dinner. There are also natural ways to help stabilize nighttime blood pressure. Gentle stretching, warm baths, or herbal teas like chamomile or lemon balm can help lower stress levels. Even light, slow walking after dinner can improve circulation and digestion, setting your body up for more peaceful sleep. One of the most transformative steps is creating a safe sleep environment. As we age, everything from clutter to poor lighting can increase nighttime stress or the risk of injury during bathroom trips. Keep pathways clear, use nightlights, and consider supportive bedding that keeps you comfortable. The goal is to create a space where your body feels secure enough to enter deeper stages of sleep. Over the years, I've watched patients make these small changes and experience remarkable improvements. Better sleep, more energy, sharper memory, steadier moods, and significantly lower stroke risk. Healthy aging isn't about perfection. It's about building habits that give your body the support it needs to function at its best. In the next part, we'll bring everything together in a heartfelt closing, reminding you why your sleep matters, why your body's whispers deserve your attention, and how your choices today can strengthen your health for years to come. As we come to the end of our time together, I want you to pause for a moment and think about everything your body has carried you through: decades of movement, memories, triumphs, and challenges. Your body has been your faithful partner, doing its best for you every single day. It deserves your awareness, your patience, and your care. Sleep problems are not signs of weakness or personal failure. They are messages from your body, gentle reminders that something inside needs attention and support. And the beautiful part is this: once you understand these messages, you gain power. Knowledge gives you confidence. It gives you independence. It helps you make choices that protect your brain, your heart, and your future. Every small decision you make each day becomes a gift to yourself. Drinking water earlier in the day, calming your mind before bed, adjusting your sleep position, listening to the signals your body sends. These simple actions strengthen your blood vessels, clear your mind, and help your heart work with ease. They are seeds of longevity that grow quietly over time. Recognizing hidden stroke triggers early can protect your ability to walk, speak, remember, and stay connected to the life you love. Prevention is not dramatic. It's gentle and steady, built from awareness and self-respect. And you don't have to walk this path alone. Senior Health Daily is here to guide you with compassion, experience, and science you can trust. I want you to feel supported, informed, and empowered every step of the way. Your health is not behind you. It is still unfolding, still worth fighting for, still capable of surprising you with strength. Listen to your body while you have clarity. Take action while you have momentum. And remember that healthy aging is always possible when you honor the messages your body sends. If this conversation touched you or helped you think differently about your sleep and your health, I invite you to stay with us. Subscribe to Senior Health Daily so we can continue this journey together, one wiser choice at a time.